Hello, my name's Candy. I work in the CSICU. Today we are going to talk about room setup for preparing to get an admission from the OR for a patient that's had open heart surgery. So let's start with the things on the counter when you're preparing for a patient that's going to have open heart surgery. So here we have our lab tubes. We have our blunt needle, our alcohol swab. We have our Chem 8. We have our ABGs that we get in 30 minutes, our iStat, in order to run the Chem 8 and the ABGs. This is just a new set of EKG leads. We just make it a practice that once the patient gets here and arrives to the unit, we reposition the leads to our liking. I have 3 saline, just that I need something for a quick flush, on the counter, ready and available. This is my 60 cc syringe to check my NG tube placement. This is an arm board, that we use to place our Swan on. We have 2 primary straight line tubings that we use for albumin and the IV Tylenol. I have a filtered IV set here, and I also have a filtered IV set on my pole that's ready for my primary fluids once they arrive. This is my secondary set for my piggybacks, Robaxin, and so forth to my primary tubing. I have a little emesis basin. I have my 2-inch silk tape, in which we're going to use to tape the Swan. The half-inch tape in order to tape our NG tube, and just some Blistex. This is our lure, our Salem sump that goes on the end of our NG tube so they don't get an ileus. Regular oral care, we don't open the big packs of oral care because they're intubated such a short time. We just use the mouth swabs. We have a medication of albumin that we hang if need be once the patient gets here, if their pressure is labile. The other part of this is just making sure that your drawers are stocked prior to your admission, so you don't have any reason to have to leave the room. And that's just really important. So next we'll move to the devices. This is the hemisphere that is set up, that you will set up prior to the patient arriving. And I'm going to go ahead and just kind of set it up and just kind of show you what goes where. So this is your slave cord that goes into your Philips monitor itself, okay? Once you have that hooked up, you have a little telephone cord we call a little telephone jack that hooks into your module of your Philips monitor that helps slave things across as well. After that, those things, only other thing you're going to have left on here will be your cardiac output cable, which once the patient arrives, you will hook this up, and we'll go through that at a later time. So make sure your height, weight, your demographics are all in your hemisphere. So now we'll move over to the wall. So on the wall, you should have your leveler, so that when the patient arrives, you're leveling your transducers with this photostatic axis, making sure that your numbers are correct. You have a 4-chamber IV pump. It must have 4 chambers on it. We also ask that you please don't remove these from the beds, the CV beds themselves. To the wall itself, you have a suction. The suction on the left is always your NG tube suction. You go ahead and set up your nasal cannula. You leave this in the bag because this lets, if someone follows you and they're like, oh, is this clean or is this dirty? As long as it's in the bag, you know that it's a clean. You have 3 suction regulators. One goes to your NG suction and the other 2 are for your chest tubes. On to the left, you have another suction regulator, and then you have your suction canister for your ET suctioning. That you'll use on that side in order to suction the patient. You have an additional suction regulator for the pleural tubes as well. This is your Hamilton vent. Every patient that has open heart surgery, Dr. Hoffman has requested that we have a Hamilton vent, and we only use Hamilton vents. Let's talk about the oxygen on the bed. It must have 15 psi before you send it down, but just make sure that your room is good to go. Over here on the counter, I always have my TriFlow in here so when I'm extubated that I can use it immediately. My heart pillow is ready to go. And then my 2 pillows, one to go behind the head and one to turn the patient after a couple hours, because we know we need to be turning our patients. In my little basin here, this is the chest tube removal, and these are pre-made up in our parlor room. I have just some footies in order to help that when the patient gets up the next morning, just for sheer convenience for my colleagues. These are some lotion, and I have my chlorhexidine, and just a little tub of 4x4s. I have some chunks pads, and then I always make sure my linen is also stocked for the colleague following me, so that it's just convenient for them when they get ready to do their bath the morning of surgery. Over to this way, I have a urinal that just is fresh and new that we'll use to empty our I's and O's. In our hopper room, you have a linen hamper, and making sure that a blue bag is in there and ready to go, so that your room is nice and neat and clean when you leave.